we have around this topic, I think that the better, and it's great to have quite a lot of conversations on social media around this. For those of you, many of you will know the International Longevity Centre in the UK are an international organisation. We're relatively small, but we are one of 16 organisations across the world. We have partner organisations who work in Australia, in places like Singapore, the United States, Dominican Republic. So we have sister organizations across the world. So clearly the international agenda is extraordinarily important to us, as our name would testify. One of our priorities at the moment is to really understand how we maximize the longevity dividend. And I suppose I'm really pleased to be able to announce today that on Monday, the 12th of October, we'll be launching our flagship global longevity dividend report, which is going to map out the economic opportunities which come from our aging world. And Sophia will talk a little bit more about that. And we're very grateful to John, who's on the line, to Legal and General, and to Sophie for supporting that really important piece of work. Today's webinar, we are working with the Department for International Trade. We've worked with the department over the last year or so and been really trying to support their activities in this space. I'm very fortunate to have had the opportunity to travel to meet some of our sister organizations over the last few years. And what's really notable is if you go to places like South Korea, Japan, Singapore, Hong Kong, you're really starting to see a lot more energy and enthusiasm about this market. You're seeing a bit more of increasing interest in the US as well. But actually, one of the things that has been really great over the last couple of years is that the UK government's recognition within their industrial strategy that older consumers, older workers, healthy aging should be at its heart. And of course, they've put their money where their mouth is and announced some funding regimes funding initiatives to support some organisations in this space as well. At ILC, we're really keen to support what they're doing, but actually not just Department for International Trade, BEIS, the Business Department, Department for Health and Social Care, Foreign and Commonwealth Office with a slightly longer name now, Innovate UK, are all bits of government we've been working with and continue to do so, and hope that with Chris, Mike, Julie, we might, when we're allowed to, be working together along with some international events, perhaps in some embassies, to push this agenda across the world. So I want to say a quick thank you to the ILC Partners. So we have an ILC Partners program. Our ILC Partners are at core to what we do, and we are very grateful for their support. We're going to kick off today, though, with Mike, who is the Chief Scientific Advisor for Department of International Trade. We've got three companies, one from big financial services, one of big healthcare, and then probably a slightly smaller tech company. And what we really wanted was to have some big companies and some small companies from different sectors talking about what export opportunities, talking about investment opportunities as they see it in this market. And then we've got Chris, who's going to talk a bit about what the Department for International Trade is doing and how they can help some of the businesses and other organisations on the line before we go to Q&A. So Mike, just to introduce Mike, say Chief Scientist at DIT. I think I've known Mike for about 15 years, back to when he worked for a telecoms provider. And over the time, had lots of really fantastic and interesting conversations about technology and aging. So I know Mike's been very interested in this topic for a long time. And I was trying to think how we actually met. And I think it might have been when I was vice chair of the Consumer Expert Group on digital switchover, where I basically spent about 4 years nagging the industry and government on why they needed to do more to support, to ensure we use digital switchover as a hook to engage older people in technology. And I remember the conversations that, with Mike and others around government about how we did try to do that. And I think one of the things that I was reflecting on earlier in the week was actually, I think Mike saw not just the desire for doing it because it was good, but because there was a real business benefit of getting this right in the light of having more and more older consumers. So, I like to think that, you know, that process did actually play a part in engaging ministers in issues around technology and aging in a way we didn't see before. And I guess the question now is how we can build on that in terms of the initiatives that government is taking forward now. So I'm going to stop there and just pass on to Mike.
Thank you very much, David. It's a pleasure to see you again, even though we can't be in the same room together. So I'm the Chief Scientific Advisor, Department of International Trade, and I have had a long passion for what I call digital health and some of the benefits that can bring everybody, but in particular, digital mobile, which is the largest technology, digital technology that we all have, either in our pockets or in our hands, with close to 9 billion customers using mobile today around the world. That's the number of subscriptions. Some have more than one device, but actually the functionality of the device shows no signs of slowing down, whether it's through photography, whether it's through video, through access to social media, through access to the internet. But even when I look at the numbers, there's still a lot more innovation to go, which is going to bring in a lot of help for those who may have either health concerns or even concerns about longevity. What we can see is that the technologies continue to evolve in terms of the senses. So we're starting to see point of care devices that may come into our homes or into our pockets. We're starting to see more smart home solutions, which will help with sensing, and machines that can actually alert to certain conditions in the home. And we're also seeing some new uses of the internet where systems can start to provide better support for routine drug alerts or drug reminders, or pharmaceutical fulfillment. So new solutions in that area. We can also see that in countries around the world which don't have as good access to hospitals or clinics as we may have in the UK, that there are better means of dealing with patients remotely, whether it be through clinical support groups or other perhaps conditions that need online customer care type groups or patient care and citizen care groups. Very pleased to take part today. Clearly, London Tech Week is a festival that's all around us. And although it's more than a week, 8 days overall, and we're into about day 6, I think, lots of activities in this London Tech Week and major festival, but good to be here today. Internationally, I think David's referred to certain parts of Asia and the USA, which are showing signs of leadership in this area. And I think we need to learn lessons internationally from many of these other countries, as well as taking some of the best of our longevity talents from the UK around the world. So I'm very pleased later on my colleague Chris Bourne will say a bit more about what the Department for International Trade is doing in this area, and he will cover some slides on that. And just to finish, I think it's also very important that we have these discussions around how longevity can be addressed globally. Very pleased to hear about the report on the 12th of October. Certainly DIT is very pleased to support this activity because we don't just see it as a market, we see it as a vital necessity that these sort of discussions extend more globally as we see more and more innovations emerging that we can take the benefit of. And these extend into areas such as financial services, health and care systems, and even the use of new technologies such as digital in all sectors and ways of life. We only have to look at e-commerce, where the UK is probably about third in the world in terms of online transactions for shopping. We can take lots of those e-commerce lessons into other countries in the name of digital, but also in the name of longevity. So we can learn lots of lessons from many sectors in society. I wish this particular seminar well and look forward to the questions being posed. Thank you, David.
Thanks, Mike. Great. Let me just pass on straight away to my colleague Sophia, who's going to give you start to sort of whet your appetite in terms of the report we will be launching in October. Our plan is to launch it alongside the finance ministers meeting in Washington, which is actually virtual now, but actually and our desire for doing so is the recognition that some of the decisions we need to be making in this space actually need to sit with finance ministers, not just health ministers. So, Sophia, let me pass on to you to sort of give some very top-line findings.
Thank you. Thanks, David. And thanks, Mike. That was really interesting to hear what the UK are doing and all the tech opportunities that are available. So as mentioned, we were just talking about a few of the findings relevant to consumption in our report, Unlocking the Longevity Dividend across the world. I just want to thank Sanofi and Legal & General for making this possible. So if we just go on the next slide. So just to give you a little bit of context, this follows on from our report in the UK, Maximising Longevity Dividend, and some of the findings there kind of relevant for this report going forward. And so what we found is that older consumer spending is rising, but not only just rising, it's actually becoming more important to the overall economy over time. It's increasing as a share of GDP, and also older consumers' market share is growing. And this is not just because there are more older consumers, but the average older consumer is spending more, and their spending is increasing at a faster rate than younger consumers. So that's really changing the market. We're also seeing that over 50s are buying, increasingly buying non-essential goods and services. So for instance, leisure services like recreation and culture, transport, particularly related to travel and household goods and services. And so we're seeing that it's not always kind of the sectors that we most think about when we think of older consumers. Often health comes at first. So we really need to not think about stereotypes and really understand this consumer market base going forward. But of course, we've only looked at ages 50 and over, and there's lots of different age groups within that and lots of variety if you go into more depth. And finally, we looked at whether there are any opportunities to increase spending further. And the idea coming from this is that there's a lot of research showing that spending falls at older ages. And that's kind of puzzled economists who think that spending should be remain constant over the life course. There are potentially some avoidable barriers there. There might be other reasons for this, but there might be some avoidable barriers that we can do something about. For instance, people can have unexpected retirement shocks. They become retired and they haven't planned for this due to a health shock, for instance, or they lose their job. That's something we can do about. But also we see that savings increase at older ages. That is something that means that there isn't an income barrier there, and there might be other barriers to spending, and particularly health. That's what the literature seems to be showing, that health could be a key barrier. And so we've considered what the impact of dealing potentially with that could be. So next slide, please. So now thinking about what's happening in different countries, and we've really focused on G20 countries, we're seeing quite similar patterns to what we're seeing in the UK there. So we're seeing that spending by households headed by someone aged 50 and over is growing in most G20 countries. It increased on average around 9% from 2010 to 2015 across the G20. And this is not only just growing, it's also growing in terms of importance to the overall economy. So it's increasing the consumer market share of older consumers is growing. And that grew from 54% to 56%. And so older households are already dominating consumer spending, and that is growing over time. And that's not just in one or two countries that are affecting this average. It's actually most countries we're seeing this pattern. Apart from, we're not seeing that in Turkey, Brazil, Latvia, and Slovakia, in the EU as well. But generally, we are seeing that elsewhere. And I think that's really interesting for two reasons. Because firstly, that just means that there is this growing export market. This isn't a one-off. So there's a huge opportunity there for businesses and innovators to tap into this. And I think firstly, that's around making goods and services inclusive. So already existing goods and services that are out there, making those inclusive, but also innovating and to understand the preferences and needs of this demographic. But there's also a role for governments there, because governments can then support businesses in their countries to tap into this, to really understand where the comparative advantage is for different sectors, and to support business to tap into that, to support jobs, income and GDP in their countries. And the final point I'd say for governments is that we are seeing that consumption might be becoming more important for the economy. Older people's consumption might be becoming more important for the economy overall. We are becoming more reliant on older consumers. And so if we do want to support consumer spending going forward, we can't ignore the older demographic. And that's relevant, for instance, in COVID, when we're wanting to think about how to support consumer spending. but another going forward as the population ages, that would be really important. So we might need to understand if there are any barriers there and try and address that. So next slide, please. And so, and in terms of what's kind of driving this trend, I think, again, similar to the UK, it's not just that the population is aging, there are more older consumers, but the average older household or older consumer is spending more over time, and their spending is actually catching up with younger consumers, younger household spending in most countries. And so we are, again, seeing in most countries that spending falls at older ages. The average consumer at older ages consumes less than the younger consumer, but over time that is changing, and that gap is falling across most G20 countries. So that's quite interesting and something we don't always take into account when projecting the silver economy going forward. And I think a key driver of this might be that we're seeing that employment rates at older ages are increasing quite fast in most countries. So we're seeing more people in work, earnings, they have more income, and that's why the average older consumer might be spending more. Next slide, please. And so finally, just to kind of put this, because the older consumer market, just to kind of see that on a global scale, we're seeing that it really is quite significant. So if you look at the aggregate spending of older households in G20 countries that we could get data for, so there's not all the G20 countries, but the countries that we get data is quite significant. That amounted to around $9,669 billion US dollars in 2015. That actually exceeds the GDP of Japan, US, Canada, and Brazil. So it really is huge on a global scale. Similarly, the US, older consumer spending in the US exceeds the GDP of Germany, as well as many other countries. So really just highlighting that this is an opportunity. We need to understand it. We need to understand the needs and preferences, because that could, put whichever businesses and countries can actually tap into that, give them a competitive advantage. Next slide, please. So finally, we've got a number of other things that we've looked at in the report. So we've also considered a little bit of a sectoral breakdown. So what are older consumers buying and how that compares across a few countries, and also there's previous studies and seeing how it's changing over time. We've also considered whether there are opportunities to increase spending further, and really focusing in this report the role of health. So we know that health might be a barrier to spending. Even if you have the same level of income, it might be affecting people to be able to spend, particularly mobility. So we're looking at how that affects spending and how that might affect older people in one country to spend less or more relative to people in another country. We also consider whether any policy strategies out there that G20 countries are doing to support or incentivize businesses to tap into this market. And finally, we've looked at a number of other topics like employment, earned income, and unpaid contributions, and looked at how health impacts these as well, and looking at trends as well in different countries. So next slide, please. So I guess if you're interested in any of those topics, we'd love to see you at our launch, and that will be on Monday, the 12th of October at 1 p.m. to 2:30 p.m. And that will be alongside the G20 finance ministers and central bankers meeting. So we'd really like to see you there. Thank you.
Great, thanks, Sophia. Really, really good. We were really keen, whilst we were breaking our own embargo, that we did use this opportunity to talk a little bit about some of our early findings. I should say there is a lot more where that comes from. We've got huge amounts of really, really interesting data in the report, including on, and I know Sharon will be
interested in this, the relationship between spending on prevention and vaccination and spending by consumers. But that's all to come in October. Let me now pass on to John to give a sort of perspective of UK large, I think it's fair to say large, John, financial services company. Again, we've worked with John and Legal & General for many years, probably about 15 years now, ILC. They're great partners and are a member of our partners program. John has been there, I think, all of that time, but had a year or so out working as Theresa May's head of policy in Number 10 a few years ago. John, can I pass on to you? You're on mute, John. Okay, oh, there you are, John, there you go.
Here we are. I'm unmuted. Sorry about that. Having a few connectivity problems this morning, but we're delighted to be supporting this work, and I'll try and offer a few perspectives of how we see this challenge and opportunity at L&G. About a decade ago, we sat down and we thought, what are the big strategic growth drivers for our business? The sort of irreversible secular trends that are going to be played out over decades. And the first one we identified was aging populations. And other things included technology and addressing climate change. But the aging demographic was the number one and biggest driver that we spotted. And at one level, that's very obvious because, you know, we're an investor of pensions and a provider of pensions. So if you have an aging population, there is going to be a longevity dividend because people save more and they decumulate more. So if we think about the growth of pensions, defined contribution in the UK currently amounts to about £350 billion. The expectation is that it'll be over £1 trillion within the next 10 years. So that is a lot of investable funds. And if we think about defined benefit, the legacy pension obligations that many companies have, those companies want to de-risk them. This de-risking through buyouts and buy-ins was a $40 billion market globally last year. The UK is about half of that. And it's going strong this year right through the pandemic. And for L&G, that pension de-risking is our single biggest profit line. It's about a little over half of the £2 billion in profit we made last year. So that's a very obvious longevity dividend. But looking beyond the pensions world, there are so many changes driven by an aging demographic around housing and later life living. We operate two growth businesses called Inspired Villages and Guild Living, which are about greater, longer, better, independent living in old age. And that is a market that is going to be expanding. Adjacent to that independent living market, we look at the whole area of social care, which was tragically hit so hard by COVID during the earlier part of this year. That's a sector that will require systematic rethinking, and therein sit challenges as well as opportunities. We're in the middle at the moment of funding a 7-year research program at Edinburgh University, which will work up new models of care. And much of that is not just about the architecture and design of residential and indeed other living facilities, but it's about data and technology. And this is another big part of the longevity dividend, which an aging demographic can deliver for the corporate sector. Data and technology are going to be front and center of this process. The tech companies know this extremely well. So it's an anecdotal example, but my 90-year-old father-in-law has started shopping on Amazon since COVID. I've told him several times you only need to press the button once. But you know, that's a widespread phenomenon now. There's also a huge amount of the voice activation work that is being worked on by big tech and that is targeted at older consumers. If we look at telephony, Great Call in the US was a company which grew from nothing to its last valuation of about $700 million. That is targeted specifically at the older consumer. And then if we look, as was mentioned earlier, at the other tech opportunities, aging demographics give you opportunities to do things with monitors, wearables, robotics, better data curation, and all of these tech areas. That's a big part of our work with Edinburgh, and there are many other big tech companies across the world working on this. If we just think about the importance of big data, most medical records are kept in natural language processing, which means that we know in the UK, for example, when somebody has a stroke, but we have no real data which tells us whether that person has an underlying frailty or not. We have very little data about who requires care and what sort of care they require. This is very valuable raw data, both to produce economic outcomes for companies, but also to produce good social outcomes. So we look then at the whole aging population, and Sophie talked about this. You know, we have an aging population which also has the bulk of disposable income. They have done very much better in relative terms over the last 10 years than the working age population. And this is a big opportunity for companies and entrepreneurs, providing, of course, they start to think in a more grown-up way about marketing. It always strikes me as a scandal almost that we have traditionally segmented consumers by, what, a dozen or 15 different groups, and then there's a group which is the over 65s. They're not all the same. We should be just as sensible and as considered about how we segment and target consumer audiences for an older demographic in the same way that we are already about doing it for younger people. It's where the money is, after all. So we need, alongside that, much better design of products and services. Again, we lag. Everybody is interested in targeting millennials, Generation X, Generation Y, for their share of wallet. However, we have ignored how the principles of good consumer production and design should relate to an older demographic and an older consumer group. So just to pick out a couple of the longevity dividends, which are, to my way of thinking, social dividends as well as economic dividends. The first point is about this volume of pension saving. It's about investment. You know, the UK is not alone in having huge pension liabilities, promises made, but insufficient assets to match against those. If you are looking after people's pension expectations, investing their pot in gilts or US Treasuries at 1 to 1.5% doesn't cut it. But this long-term, sticky pension money can be used for all sorts of other things. It should be used for urban regeneration, housing, clean, renewable energy. L&G has invested about 28 billion across these things, with more to come. And the £4 billion of that we are investing alongside Oxford University will again be largely annuity money, reflecting an aging demographic, most of it from bought-out pension funds. This money can be put to really productive use across the broader economy. Hopefully, regulatory change will facilitate the greater investment of defined contribution pensions to enable us to allocate a small percentage of that to venture capital, to growth, startups and scale-ups. A small percentage of, say, 3 to 5% of that £1 trillion will be a game-changing amount of money for our growth company sector. That's investment. Second point about the dividend is about population health and resilience. And one of the great lessons from COVID was that it taught us that health equals wealth at a population level and often at an individual level too. The growth dividend here, of course, is more, should I say, conditional, because alongside the obvious potential economic gains from COVID vaccines, we have to think about opportunities for better management of long-term conditions which create underlying vulnerability. This should be a growth area. There are many people in the life science and tech sectors working on it. The conditions they're looking at include manageable conditions like type 2 diabetes, various cardiovascular conditions, and of course obesity and many more besides. If we assume the importance of greater, longer independent living at higher quality and better designed residential care where it's needed, then the work that we're doing with Edinburgh and will soon be doing elsewhere, I'm hoping to be able to announce that in the next 10 days or so, will be incredibly important. This is about also increasing primary and preventative healthcare budgets versus hospitals. And it's about constructive private and public cooperation. Finally, just to cover the trade and export potential. This is a global challenge. It's not just about longevity across the world, but it's also about the combination of falling birth rates and rising longevity. If we just think about the one-child policy, that means that for every 4 grandparents, there will be 1 grandchild. we have to think about the aging demographic when we're looking at consumers. One of the social dividends we need to get alongside the economic dividend is the ability to address what you could call the bifurcation in longevity between the rich and the poor. This has to be a huge worry and a huge challenge. We see it most pronouncedly in the US, but here too, virtually a 20-year divide in healthy life expectancy. It is a terrible social outcome and economic outcome if people are living longer but in terrible health and with higher rates of dependency. Now, economists have long thought that an older population is a problem for productivity and a problem for public finance. That's not necessarily the case if we can address things like the ability, the flexibility for people to work longer. But it is the case if we continue to see more poorer people sicker for longer in old age. So that, I think, has got to be a priority for public policy. It's also something that's very important for business. I hope Tina's on the call because we've been working on this hard recently. Business needs to step up. You know, we can't see repeats of the sort of example that you find in the Deaths of Despair book by Anne Case and Angus Deaton. They cite a place in West Virginia, a place called Kermit, which has a population of 406 people, and in a 2-year period received 9 million pills, hydrocodone, oxycodone, fentanyl, painkillers. Now, that is a terrible outcome, and we need to care as much about population health as we do about climate. There's no reason why we as businesses shouldn't up our game in this area. We need to care. We need to step up. And if aging populations, for us at L&G, are going to be one of the main drivers for our profits going forward, that must be true for others as well. So I would urge a recognition, first, that there is huge opportunity here, and second, that there is also huge responsibility to make sure that health and wealth and the aging population are properly joined up to deliver benefits for all. So David, delighted to be working with you on this and supporting it, and to be here at the seminar, even though you can't see me. So look forward to the questions. Thanks.
Great, thank you very much, John. I'm going to pass straight on now to Sharon McHale, and I'm sure the message of health and equals wealth will be one that she may want to touch on as well. We've worked with Seqirus for probably less long than with Legal & General, but the last few years, Seqirus were one of the partners who has been supporting the work we've been doing globally to try and promote the case for prevention in an aging world. So essentially make the argument that it's never too late to prevent ill health. And for those of you who don't know, within that program, we one of the activities we did last year is we went over to Japan to talk to the health ministers as part of the G20 health ministers event, and had 5 or 6 of the delegations there. And I think we certainly played a part in, and this perhaps build on John's point as well, of convincing the health ministers that there was a need for a much greater focus on preventative health in this space. And I think they're at least saying the right words now. And I think the challenge going forward, and we're about to launch the second stage of that program, is for us to work out, not just, move from the kind words to the how. How do we convince them to not just say it, but actually to deliver, for example, increasing spend on prevention. So Sharon, what's your perspective here?
Oh, thank you very much, David. It's great to be here and to contribute to the discussion today. I'm going to take a step back, I guess, and talk more broadly about vaccines and its relationship to not just healthy aging, and preventative health, but also the economic factors from an industry perspective too. So, firstly, just a little bit about Seqirus. So, just to give context to my remarks, we are one of the world's largest manufacturers of influenza vaccines, and we We have a particular focus on innovative technologies that meet the needs of different populations. Like many vaccine companies, we're also actively engaged in a number of collaborations to develop a safe and effective COVID-19 vaccine as rapidly as possible. We're headquartered here in the UK. We have manufacturing and R&D hubs across 3 continents and export to more than 20 countries. Our manufacturing site in Liverpool employs over 700 highly skilled workers and annually produces over 50 million doses of flu vaccine. And that's a vaccine that's specifically designed for older adults. And we're currently expanding that facility to meet increased global demand and to also strengthen pandemic response for the UK and the region. Our operations in the UK contribute more than $1 billion to the UK economy every year, and I'm pleased to say that that this is growing. And I'll tell you a bit more about why. So why have we chosen to specialise in influenza vaccines? The key reason is the significant public health need and also the associated social and economic opportunity, which you've already heard about from several speakers. According to the WHO, influenza causes up to 650,000 deaths around the world every year. That number often surprises people. More than 40,000 of these deaths are thought to occur in Europe. And closer to home here, Public Health England estimates almost 64,000 people have died from influenza in England over the past 5 years. Older adults are disproportionately impacted by influenza, and that's due to our ageing immune systems and also the increased likelihood of chronic diseases as we age. So there are far more flu-related deaths and hospitalisations in the 65 years and above age group than any other. Months after recovering from flu symptoms, older adults may still be at an increased risk of a heart attack, stroke, and other cardiovascular problems. And even when all of these risks have passed, some older adults will never fully regain their pre-influenza health and abilities. And influenza is really costly. A recent study estimates that the economic burden of influenza in the US each year is $87 billion, 2/3 of which is attributable to influenza infection in older adults. So the social and economic costs and lost opportunities resulting from the impact of influenza alone underscore the critical importance of healthy ageing and the value of vaccination. And as has already been mentioned, the importance of increased budgets for preventative healthcare. The ambition for flu vaccine coverage is to reach or exceed 75% uptake for people aged 65 years and over. That's recommended by the WHO. The UK has the highest immunisation rates for older adults, 72%, highest rate across Europe at 72%, and the second highest globally behind South Korea. But influenza immunisation rates are significantly lower across most of the world for flu vaccine immunisation, so there's significant opportunity there. And many countries don't have comprehensive programs with that also cater to particular age groups. So the particular burden of influenza in older adults and the market opportunities has led to increased investment in development of more effective vaccines for this age group. So in 2018, we introduced an adjuvanted influenza vaccine into the UK for people aged 65 plus, made here in Liverpool. The adjuvant aims to boost the immune response for better protection. It's got a preferred recommendation from the NHS, and we supply over 10 million doses here in the UK each season, and we're also now exporting that vaccine to an increasing number of countries around the world. And we've started work on the next generation of that vaccine already, as well as some other longer term innovative technologies. And the adjuvant, or the boosting agent I just spoke about, is also being used in our COVID-19 vaccine development programs. So the operating environment in the UK is really important to our global efforts. We chose to headquarter Seqirus in the UK for a number of reasons. strong life science sector, policies supportive of innovation, trade and immunisation, access to specialised skills and talent, proximity to other Northern Hemisphere markets. And these characteristics are going to be even more important in the UK's approach to COVID-19 recovery and also sustainable growth into the future. So what has COVID-19 meant for our business, and what are some of the future opportunities? So with the potential for the pandemic to persist, the current pandemic to persist or resurge in winter, and the particular vulnerability of older adults to both flu and COVID means flu vaccinations going to be more important than ever this upcoming season. And as a result, we've seen an unprecedented demand for influenza vaccines as governments are seeking to protect their at-risk groups and ensure that precious hospital resources are available for COVID-19 patients. What has been particularly encouraging has been increased demand from countries that traditionally have had relatively low influenza vaccination rates for at-risk groups. We've also seen a number of immunisation policy changes in different countries to increase influenza vaccination coverage during the pandemic. For example, Australia required anybody entering a care home to be vaccinated against influenza. And here in the UK, the government has expanded its older adult vaccination program from being for 65 plus and above to being for people aged 50 years and above, which is a really encouraging development as well. Manufacturers have done their best to respond to the increasing demand by increasing production, but flu vaccines have a 6 to 8 month lead time, so there have been some challenges in meeting this unexpected demand. We certainly do welcome the policy changes and encourage governments to consider making them permanent beyond the acute pandemic period to reduce influenza-related deaths and hospitalisations each year, and to contribute to the social and economic recovery post-COVID, but also the sustainable growth that we've heard about as well today. So sustaining these higher vaccine coverage rates can also, what that does is it gives manufacturers increased confidence to invest in their facilities to expand their capacities, which generates further economic activity around those facilities and also helps to strengthen pandemic response because you've got higher rates of throughput of vaccine all year round. And finally, I would say that COVID-19 has generated an extraordinary amount of collaboration across borders and around the world between governments, academia, public health organisations, advocacy groups, and industry. And this level of collaboration, which has been unseen before, is really powering innovation, not just across science and technology, but also in public policy and program implementation. And our hope is that this will become part of the new norm for driving global social and economic growth. I'll stop there, David, and hope that gives a different perspective to the conversation today.
Great, thank you very much, Sharon. And some work that we did as part of the prevention program last year highlighted that 150 million working days were lost in 2018 alone due to flu vaccination and the economic cost. Due to influenza across richer countries, and the economic cost of influenza across richer countries was 39 billion. So there's some big economic costs of that I think are really important to recognise. Let me now pass on to Amir, who I don't think will object to me highlighting it. Probably a little bit smaller companies than the companies we've had so far, but great to have both a tech company involved who's in, I think, exactly the space and some of the things that both Mike and indeed John were talking about. Let me pass over to Amir.
Thanks very much, David. I'm hoping you can hear me and see me. So
yeah, all good.
Great. Can we move to the next slide? Thank you very much. So yes, you're right, David. I have no objection to being one of the smaller entities compared to some of the others on here. I think small will lead to being nimble, agile, and flexible, which is exactly where I think we need to be. Despite this conference being for longevity, and therefore the perception being that it's for older adults and things don't change, I think that's exactly the space that requires the most dynamism. It's where we need to be the most open in terms of our thinking, and where we need to be very inventive and creative with regards to design and how we engage people in systems, technologies, that will help them to live more healthy and fulfilling lives. So I'm going to talk a little bit about what we've built at Cradle. It's the only TV-based remote health and wellbeing platform. And I think one of the points was made earlier about designing and viewing, well, designing products for consumers and seeing older adults as consumers who have their own requirements and are looking for products themselves. So we've taken a very user-centric design here, and we've built this platform. So I'll just describe the platform in the next slide, please. So I'll look at the TV-based side of it first, and then go to the remote monitoring piece secondly. So there a lot of technologies are available for designed to help older adults live healthy, well-being lives, live healthily, and to support their well-being. One of the aspects that we focus on is social connectivity, and what we've created here is a system that uses the TV, and it can be any TV as long as it has an HDMI port to enable video conferencing. The system that you see is basically the remote control. You can see that on the left, and the interface on the TV there. The interface is driven by yes/no commands. There's a green and blue button on the screen, green and blue button on the remote control, and that's literally all the user needs to know. If the user can read subtitles, they can use the interface. So the example there is, would you like to make a video call? The user says yes. Would you like to call person X? User says no, then it scrolls automatically to the next one or the next one. It's a very, very simple system to use. You can see the video camera sits on top of the TV, and there is an automated motorized shutter that moves in front of the camera when a call starts. Sorry, moves away from the front of the camera when the call starts, and moves back in front of the camera when the call finishes. We've got some sensors that are built into that hub that sits on top of the TV, and that's where our remote monitoring platform actually starts. But before we go into that, if you look at the middle picture here, we have a smartphone app, and this is how, if my mother has this in her home, this is I use my smartphone with the Connect app to make a video call to her TV. It's very simple and straightforward, and just like any of the social connectivity apps that are out there, you can upload photos and videos, and they can be viewed on the user's TV as well. So it really, this aspect of what we built delivers the social connectivity that we think is an essential part of a healthy, well-rounded life. Social isolation and loneliness are such major factors in society today that we think that is essential that we address those. And while smart screen technology has really addressed connectivity for people who don't use smart screen technology, they're excluded. And that's why we think that opening up the TV as an extra platform is going to help. On the right-hand side, you see an image of our dashboard, and this is where the uniqueness of what we've built actually starts to come in. We are a social connectivity and an IoT platform in one, and we haven't come across other offerings which do this through the TV. The sensors on the hub that I talked about that are between those two white squares there, the LEDs, they send their data to the dashboard on the right-hand side. And so health and well-being can be monitored by, there may be supporters in the user's network. So I'd be a supporter for my mother, for example, but also the carers from both health and social can gather data and monitor a person's well-being remotely. Can we move to the next slide, please? So we're fully fledged IoT platform, as I said. We've got sensors inside the hub itself, but we've also connected a whole range of devices. So you can see at the top there's a whole range of connected home devices around monitoring electricity, water, smoke alarms, doorbells, etc. For health, we've integrated, and these are all third-party devices. We don't manufacture any of these. These are devices that have APIs available and we integrate them. You can monitor a whole range of device conditions. So I've just put some examples of a blood pressure monitor, an oximeter, or a thermometer. As we know, in COVID-19, the symptoms around dry cough lead to lower blood saturation for oxygen. Oximeters are used to measure that. We've integrated an oximeter in here, and that's used to monitor for COVID remotely, as well as the thermometer. Both of these devices, well, all these devices send their data to the dashboard, and that's how carers, both people who are part of the family or professional carers, can monitor well-being. So we've got a whole spectrum of devices that we're integrating, and we're increasing that number going forward. And what we're really trying to show here is the connected home concept, and that the data from the activities of daily living, from remote health monitoring, can all be brought together in a user-centered fashion. These are all Bluetooth devices. They all pair with the Cradle, with the Connect hub, automatically when they come out of the box. You just put the batteries in the devices and they pair. They seek a Bluetooth signal. We've selected devices so that the user doesn't actually have to do anything. So, so we think with coupling the social connectivity through the TV, so we sidestep sort of techno anxiety there, as well as the integration of a large range of devices and the onboard sensors inside the hub. So we're monitoring room temperature, we're monitoring physical motion, humidity from inside the hub, but that's inside the TV room. You know, by integrating physical movement sensors around the home or sleep monitors in the person's underneath the person's bed, you can really start to get a good sense of what constitutes healthy living and start to provide some insight and support on how to improve that. So social well-being and an IoT platform is what we've built. If we could go to the next slide, please. We are working closely with healthcare, home care, with charities, from the range of devices that we have, you can imagine there are a large number of deployments and use cases that are being tested. So in some trusts, for example, they're using the system to reduce the anxiety that people feel after extended stays in hospital and being discharged to home and having to be independent. They can make calls through their TV, speak to the consultants through the TV, and therefore not feel that they have to go into A&E. Similarly, we talked about COVID-19 remote monitoring, but then also for conditions like congestive heart failure, for well-being checks by domiciliary care workers. You know, this is where the combination of the TV and the remote monitoring devices all start to really live. We're working closely with Age UK, Alzheimer's Society, to start thinking about how we could make events, for example, streamed to people's TVs. So if the people are mobility limited and they can't join those events physically, can they do it remotely? And especially when it comes to situations like shielding from COVID, we know that this kind of thing this kind of deployment of technology starts to become very important. We're also looking to address factors such as digital exclusion. So we want to make educational content available on our platform and various other activities that can help address people's exclusion from today's world and bring them more into the fold. Finally, we've been very pleased with the kind of support that we get from Chris from Hassan Chaudhry, from various others in DIT. It's a really fantastic organization that's helping us get out there. We've been giving our messages through to Southeast Asia, Australia, US, and we're getting a lot of interest from those markets. It's great for us, being a small company, people are seeing that there's a degree of flexibility that we can bring. We're not coming in with a hard-baked way of doing things. We're looking to deliver and fit the needs that different clients and customers are articulating to us. So we're seeing a lot of interest both here in the UK and internationally, and we think that we've got something that that people are going to be very pleased to see the impact of. Just the next slide, please. Yeah, so just to close, we think we've got something unique. We're bringing together a social health and wellness. We're doing it through a platform that people are familiar with. We're trying to be user-centric. We're trying to treat our users as consumers, not just old people who have problems that need solving. And we're trying to deliver on a promise of healthy aging in a new way that we think will deliver that kind of solution. And we want to work in partnership with some larger organizations out there who are thinking about this in the same way. So thanks very much, David. Back to you.
Great, thank you very much. And last but definitely not least, I'm going to pass you over to Chris, who's going to talk about what support the department is providing and can provide for in relation to some of the issues that have come up today. Chris. You're on mute, Chris.
Okay. Okay. Hopefully you can both hear and see me. So thanks very much, David. Yes, I mean, as you've heard, the UK is a great place to develop a lot of innovation, new ideas, new systems, and product services, and indeed developing businesses. If I can have the next slide, please. This is really based on the industrial strategy for us as part of government, because clearly this is something that the current government is also very keen to promote. And with this mission of increasing the number of extra healthy and independent years of life. Now that's a real challenge. 5 extra healthy independent years of life is what we're trying to achieve by 2035, which means not just looking at how we support people, but how we narrow the gap between the richest and the poorest. So this is a social and economic endeavour to really improve the lives of people within the UK, but in doing so, helping industry to develop the responses to make that happen. And that's included some quite major investments, including a big challenge fund, £98 million challenge fund, to support that endeavour of developing our capability really to respond to an ageing society. Next slide, please. And our job in the Trade Department, International Trade Department, really is to look at investment and trade to support that. So as we develop our capability, our ability to engage an older population in living a fuller life and a healthier life and a well-supported life, how can we make sure that our innovations, our discoveries are shared across the world through trade, exporting expertise like Emma's been talking about, and through investment, bringing in companies that want to settle in the UK, as we've heard Securus making that decision, other companies who want to invest in UK innovation. But also we work with colleagues who work on international development, which of course is a benefit to populations in other countries, as well as potentially to the economy of the UK. And indeed through science and innovation, linking science and innovation institutions across the world with the UK. We have over 100 institutions in the UK working on aging society issues. So we've got a very strong research and development base alongside our economic base. Next slide, please. So what are we trying to offer the world, as it were? Well, these are the areas we feel that we've got most potential and most to offer. both in terms of exporting our expertise, but also bringing investment into the UK. We've heard already quite a lot about prevention and diagnostics, including through the vaccination programs and diagnostic systems that can, as we've heard from very early on, using quite basic monitoring tools, identify people's needs as well as the more complex diagnostic systems. Advanced therapies, clearly we're known for a place that's doing fantastic research and finding new ways. I mean, we're talking now, aren't we, of extending life hugely, potentially through advanced therapies and through advanced cell technology. So I think we're definitely see our expertise as something we can offer to other countries from the UK. At the same time, helping people live with disability or with illness or post-illness, or post-injury through rehabilitation and through use of medical technologies. We've heard a lot about digital and technology solutions, including from Mike Short, as well as the example you've just heard in Cradle. We've got fantastic companies who've got really exciting ideas and are ready to share those overseas. Mental health and well-being. Well, we know that in any group in society, at least a quarter of people have some mental health and well-being issues, and needing to make sure we can support people. As I think Emma has said, loneliness is one of the key problems that people face, particularly in older age, and these obviously have big health results, bad results that we need to address. Dementia care is an area of special interest we have, both from research, but also through our treatment and support systems. And also then the last two things are around how we develop care homes, particularly post-COVID, and care villages for people to enjoy life in old age and also in their final months and years. And that does mean developing the capacity of people to stay in their own homes. And Cradle is a very interesting example of how we're supporting people in their own homes. So this offer we're making to the world, I think, is a very well-rounded offer. The next slide, please. It's because it's not just about the more traditional health care and care systems. It's also about prevention, and these set of seven areas that we're trying to work on are developed by the Centre for Better Ageing as part of their work for Innovate UK, which is delivering the Challenge Fund, recognising these are key areas, whether it be, managing the common complaints of ageing. My background is in healthcare and indeed in social care, and foot problems, for example, we know are a huge issue for older people, just personally, subjectively, but also lead to huge disability and potential illness because of just not having a basic issue of foot problems being addressed. So if you go through all of these, they look quite basic, but actually need a lot of new technology as well as new systems and efficiency to deliver. So if you look at supporting social connections, that's exactly what Cradle is trying to do, for example, as part of its service, and also making places that are good for people to live in and good for people to get out and about and enjoy a healthy and creative place. So it raises the whole issue about how we design new centres, new buildings, new estates. There's a lot to be done to make these more accessible and livable for older people as well as for the whole population. Next slide, please. Now, it's not just health and care we're talking about here. Ageing society covers probably most sectors that we think about as we develop our economy, as we develop our ideas, we develop our capabilities. And looking at things like transport and mobility, for example, is critical to how people can live well in the future. Autonomous cars are potentially revolutionary for older people as well as for a lot of other people, to enable them to live and get about and see relatives and so on. So there's a lot we need to make sure that these new technologies are developed in a way that is accessible for older people as well as for the whole population. Similarly, around smart cities, I've talked about the importance of place for people and making them accessible. So I think we're trying to make sure that all our sectors are relevant to older people. We think of consumer and retail. This isn't about creating special products for old people. It's about making products that are accessible for all age groups, but including and making sure they are relevant to older people. So we're trying to make sure we're promoting not just the industry, but the capability to take these ideas overseas, as well as bringing in investment to the UK in these sectors. Next slide, please. So there's a lot of support that DIT as government can offer companies. There's this website, great.gov.uk, where you can register your interest to export, where you can export, where potential customers can find you on the on this website, as well as you finding opportunities there. And so that's an important place to start from. But if you go on to the next slide, please. There's a whole range of supporters as well around. So across our regions, there are trade advisors to provide a whole range of support really on how to develop your export campaign, your export thinking, and how you can be effective in that, and which countries you may want to focus on. We have some specialists working in our headquarters, normally based in London, but not always at the moment. But myself and a colleague, Linda McGee, who's our Deputy Ambassador for the Aging Society for the DIT, but also a specialist, Julie Taylor, who works exclusively on Europe, but has developed a lot of expertise around how we can support companies and organisations to take their expertise overseas and bring in investment to the UK. Some interesting events even now coming up, despite the COVID pandemic. So we have an event in China that is about to kick off, which will be a virtual exhibition. People can put their collateral onto a website as part of an exhibition and conference in China on the 28th of October. But we'll be pre-recording everything, so to make it very easy for people to put it there. And there'll be a live audience, but also a streamed audience. So just as one example, you see a lot of webinars that are coming up in Europe, in particular countries, in Spain and Portugal and Austria and France coming up just next month and the one after, where companies can describe what they're doing and meet customers through the webinars. And when we're able to travel more, there'll probably be some more of our traditional Great Weeks, which are a chance to promote the UK's expertise, not just for trade and investment, but in science and collaboration, as well as, if you like, flying the flag for what the UK is doing with its ageing society. And there's a whole list of these events, which you can find again on our events website. Across the world, of course, we have commercial teams who are ready to advise companies who want to come to a particular market and find opportunities for you to pick up. And we work closely with partners such as the China-Britain Business Council, the UK-India Business Council, and those sorts of councils in each country. So a wide range of support available. We go on to the next slide, just to remind you that the three of us have been working from the UK, working across the world with our network of colleagues across the embassies and high commissions, as well as within the regions within England and the devolved administration. So we're here to help and keen to hear from companies who want to engage in this journey with us. Thank you very much indeed, David, and happy to answer any questions that are coming up. Thank you.
Great, thank you, Chris. And I think we're now going to move on for about half an hour to questions and discussion. We've got some questions in the Q&A. Please do highlight them, flag them. I think there's a thumbs up button, and if you touch that, they go higher up the priority list. And please do add your own comments in as well. Perhaps just starting off, there's a comment there right at the top. So it shows democracy works sometimes. A question at the top. Well, there was a question from the top. Oh, there is still from Tina Woods, who was mentioned earlier by John. Who says, where could Britain lead the world? Where could we lead the world in terms of this marketplace? And I suppose sort of there's a couple of questions relevant to that people have posted as well. Where do we stand globally, and how do we really push us up? And I suppose for the companies here, what else could be done to support support, by government to support them. And there's a comment sort of a bit later on from an ILC friend, Maggie Ellis, who talks about the fact that in places like Estonia, you already have sort of 93% of the population with all sorts of digital access to their own records. And I sort of, if you think about it, it's actually, I think now about 20 years since Tony Blair announced we would all have our own individual patient records. In some areas it feels like we're being relatively slow compared to some countries. Is that fair? So lots of questions there. Where do we stand globally, and what more can we do? Mike, do you want to come in on that?
Happy to do so. I think there are 5 areas where we have some obvious strengths. This may undercall some of it, but let me just make a start. So earlier I said e-commerce, so our ability to deal online is actually very strong, and increasing that's about information access. That could be about video, it could be about digital citizens having connectivity for what they need, wherever they need it, at any time, anywhere. Secondly, I think pharma, we have some obvious strengths. That's been seen with the recent Gavi summit, which looked at collaboration around vaccines for COVID-19 and the development, but also the funding and distribution of pharmaceuticals. So I think some of the issues around efficacious testing as well as funding and distribution play a part there. Thirdly, I think some of the demonstrators we have, particularly with the support of Innovate UK or the Health Research System, or the AHSNs, I think that demonstrator capacity is very valuable. And sometimes harnessing those demonstrators for collaboration is important, whether it be around new technologies or new systems, I don't mind, but lots of demonstrators with research support. I think the NHS deserves a mention. It's the biggest national public health service in the world, I believe. Clearly, it's got its challenges, it always will have, but the reality is it's seen as an exemplar, and within the NHS, I'm sure there are some significant solutions there that could be brought forward. I'm on the board of Healthcare UK, and as such, we look often to the NHS to give other examples. And lastly, I think some of the digital systems we have in place may not be quite the likes of Estonia, but Estonia didn't really have a system which could be described as passed on from the former USSR. They had very much an old system, so they had reasons they had to change, which were quite different for us moving towards digital systems. But some of the digital systems we have, which have shown how well the health services coped with COVID-19, including emergency systems, including areas to do with various testing activities, particularly around blood, particularly around high-end diseases. And I think a lot of those digital systems are of high interest to many countries. Many of these would be covered by the slide that Chris Bourne had. Clearly, we might need to do more work with integration of social care, but I think the digital systems is a strong card we still have. Thank you.
Thanks, Mike. That's great. There is. I should say, there's another comment in the questions around the fact that some of the economies across the world are younger than others, but even those economies that are relatively young are likely to need to prepare in terms of the future and in terms of the market opportunities. So that's with that in mind as well. John, as someone who invests across the world, as a Legal and General, as a big sort of investor and export, where do you see the big opportunities? Not necessarily just for Legal and General, but for broadly financial services and the UK PLC.
Thanks, David. I think one point about this is the strength of the universities that we have in the UK. We have, I think, 4 or 5 out of the global top 20, and we can lead in collaboration between universities and businesses and government to develop really world-leading solutions. And Edinburgh, with which we work, is hugely well regarded, for example, in China. And so you have a door that is open there. Another area where we can lead, I think, is in and around pensions. we have a better system than many, and we can build on that. And then data has already been mentioned, but I would just pick out, for example, in Scotland, we have extremely good NHS data. It's more joined up than anywhere else, which is a function partly of size, but the data lock, as it's called, should enable us to gain some real world-leading insights. So I think we've got plenty going for us in terms of investment and the global outlook around that. It is pretty much a level playing field, and again, I would pick Asia as an area where there is a lot of potential for investment in aging populations. A lot to learn, actually, from Japan, for example, but a lot of money that could be flown into Japan as well. And China has one of the biggest catch-up jobs to do. There isn't really a great pension scheme there in the sense that we would understand it. So plenty of opportunities.
Thanks, John. Sharon, do you want to come in from a healthcare company perspective? You're on mute, Sharon. Okay, well, perhaps we'll come to Amir. Amir, have you got anything you'd like to add to this bit as a smaller tech company?
Sorry, I forgot I was on mute. Yeah, look, I think there's a lot of scope. I mean, the opportunities that are arising in the UK, they're not dissimilar from around the world. And remember, it's a global village now. What we see, the kind of people that we're looking to address, also have lots of friends, family, relatives overseas. So what we can build here in the UK could be for a UK population, but can also be for an international population that works with the UK-based population. We're also opening up new ways of working, right? So remote monitoring and remote health. This is all a way. These are all based on the transmission of data and the analyses of data. So what we're hoping is that there are going to be whole new areas that open up. The way we're working with the NHS, the point about it being an exemplar is absolutely there. If we can show use cases of how we work with the NHS, people get very enthused about those. Some of the discussions in the US are based upon how we work with the NHS. And finally, this whole area around data and the analytics that can be driven off data. The UK leads in AI and in advanced analytics, data science. It's absolutely critical to our business going forward, and that's why we think we're in a great position to really drive forward and shape the whole space in longevity.
Great, thanks very much. Let me. Oh, are you there? Sorry, Sharon. There you go.
No. I tried to unmute and I got the circle of death, so I had to pop out and come back in. So just quickly to add, it's interesting. Estonia has been brought up as an example. It might be good on tech, but actually, influenza vaccination rates above the 65 plus is at 2%. So there's opportunity there. No question about that. But I would just add to what has already been said in terms of the strength of the life sciences sector that the UK already has. It is a very strong sector, and I think there's a real opportunity to continue to build on that. With vaccines in particular, we do have some leading practice here in the UK. As I mentioned, flu vaccination rates are up around 72%. There's obviously more room for work, more work to be done there, but certainly that's as I said, it's second highest in the world. So and other countries do look to the UK for practice. So I think that's certainly something that the government can continue to build on, and the understanding of the relationship between healthcare policies and companies' ability or desire or rationale to invest more in technology and manufacturing in the UK as well.
Great. No, thanks. That's great. Let me just move to slightly. There's a few questions in there around actually around climate change, and I know John mentioned climate change as well. ILC UK are beginning to work with our 15 other partners across the world on a big global project looking at the interrelationship between climate change and aging. And historically, older people have either been, I think, perceived as a casualty of climate change or a contributor, and perhaps a lot less a champion and with an active role in terms of tackling some of the challenges. I wonder if, you know, the panel, in terms of the sort of the economic opportunities and the chat, you know, to what extent, you know, is climate change, you know, a potential disruptor in terms of, you know, in terms of this market, or are there ways that we can tie together the need for good health? Clearly, we would argue yes, but good health, aging, and also tackling the challenges of climate change. Does anyone want to come in? Mike, again, do you want to talk about that?
So the UK is the host for the COP26 talks, the climate change talks next year. That provides a great opportunity for demonstration of solutions that can help in the broader climate change area. And I would cite the crossover to things like environmental measurement and pollution. I think that's a very clear area with crossover towards health. And I would hope we can show and demonstrate better environmental measurement systems, which will contribute towards better health and well-being for everybody. I'd also suggest that some of the infrastructure investments, which are about protecting people, should help in the prevention arena. I've been involved with some of the digital systems in Asia Pacific, for example, about tsunami alerts or possibly typhoon alerts. So some of these alerting mechanisms use digital technology in ways which we've not previously considered of. And we're not going to reverse some of the climate change. So we need to be in a preventative and reaction alert mode where some of these digital systems can make a big difference. I do think energy consumption will be a strong focus of many parts of the climate change movement going forward. So I think we do need to look towards new mobility systems, new forms of electrification, new clean fuels. And I'm sure we'll hear a lot more about those linkages to better health and well-being as well.
Thanks, Mike. Do any of our other companies want to come in on climate change? John, I know you've done lots in this space, and I suspect climate change as well as demography and aging is up there amongst your big trend that you're very focused on. And of course, you invest very significantly in housing, where clearly climate change is an extraordinarily important issue. John, have you got sort of anything about how you'd like to say about how we can tie these two important themes together in terms of the role of business? You've just gone to, there you go, John. You're not on mute, but I don't think we can hear you. No. Okay, we'll come back to you if we. Oh, there you go, John. You're not on mute.
Muted. Sorry.
There you go.
Yeah, I think in terms of climate and older people, David Attenborough does pretty well. But the thing I would call out, well, two things. The first one is about, as you say, housing and construction. I mean, as we build better and more specific housing for multi-generational occupants and indeed specialist housing for older people, we can make that much more climate friendly and move towards carbon neutrality. The other challenge, of course, is housing retrofit. I mean, in the UK, about 20% of greenhouse gases are from domestic housing. And if we can find a variant of the Green Deal or some successor to that, which actually works for the occupants, whether they're owners or indeed the landlords, whether the home is socially or commercially for rent, then we can make a big impact. And that's something we're actively engaged in trying to do. Nobody has cracked that completely yet, but it's very important. So there's that, and then I think on the funding of climate change, again, there is this huge pool of pension money that could be partly used for that. And if you're looking at a world now where renewable energy generation is not a kind of gift for which you have to make a sacrifice, but is actually something which is economically viable in its own right, clean, green, and cheap, then that is highly investable. And our annuity funds, which are ultimately older people's money, invest quite heavily in wind power and solar power. So I think there's a broader economic picture, and aging demographics and climate change do link up in that financial sense as well.
David, I don't know if you can hear me and whether I can make a comment.
Yeah. Go on, Chris. Yeah.
So, I mean, the NHS is one of the biggest emitters of carbon in the country. You won't be surprised to hear, because it's quite, a lot of it is building based. But on the other hand, we do have a very strong primary and community care service compared with a lot of other countries, and indeed our services for older people in the community are despite our own challenges, are a lot better and more extensive than a lot of countries. So I think we've got a lot to advise and help with around avoiding using big institutions, because they're the ones that emit the most carbon, and trying to, all the systems we are developing to help people either both stay at home, obviously get out from home to do interesting things, but also to be at home and stay at home and get support at home and get, if necessary, treatment and rehabilitation as much as possible at home or nearby, are really important efforts to help people not only live a better life and be healthier, but also actually to reduce their carbon footprint. So I think, I remember talking to a Chinese audience and saying really the best way to reduce to make the health service a greener place is to have fewer hospitals, or use hospitals less, put it that way. So I think there's the fact that we've already got a much more integrated system, a lot more to do, an integrated system that has more going on in people's homes in the community is an important thing we can offer, both as ideas, but also as actual systems and products and services. And the more that we develop, especially the digital component of that, the more we're going to be able to reduce the climate impact or the carbon emissions of health and care services themselves, as well as everything we've heard about around housing itself. So I just think that's worth thinking about, the offer we can make that is around having alternatives to people ending up.
Great, thanks, Chris. I'm just going to move on to a final question then, perhaps if I can get all of the panel ready for perhaps a final sort of last comment they may have in terms of either a policy or practical ask that they might have of government, or if you are from Mike and Chris, a final emphasis of your offer to those on the call. But before I do that, the final sort of question that comes up a lot in the Q&A is around the role of older workers, how we can support older workers, lifelong learning, the extent to which I think older workers are, potentially an export asset to the UK, and how we can maximise that. And then I think also the extent to which the companies we've got on board, so Seguros and L&G, for example, are using and engaging with older workers. So again, can I come to you, Mike, first? What's the is there a skills opportunity here, an export opportunity for older workers, and how do we maximise that?
Well, I think some of the areas the UK already has shows we've got a very strong skilled base within the UK, but we do have an ageing workforce. And some of that talent may be retiring too early. So we need to look at incentives to both enjoy the fruits of diversity and inclusion, which includes all ages and all genders. I think some of the talent gaps we can see with an aging workforce will mean that we have to retain people on a longer basis. some of the things that may be dying arts. It doesn't mean that people necessarily have to work full time, nor necessarily go into an office or a factory. Maybe it's working from home with some of the new digital techniques that exist. And when it comes to dealing internationally, we've talked about sector strengths in the UK, and some of these are seen as valuable from an overseas and an export point of view. So we just need to make it easy for some of these skills and capabilities to be exportable into the nations that we think may need some help. Clearly, some of them are attracted by the talent base itself. Universities have been referred to a few times, but it's no longer universities for young people, it's universities for all. And therefore, sharing some of these talents internationally may lead towards better, diverse ideas, as well as a diversity of talent around the world. I'm very happy that we've been able to support this particular seminar today, and we just need to keep our foot on the pedal. Thank you.
Thanks, Mike. Sharon, you talked about having the skilled workforce you've got up in Liverpool. To what extent is could you benefit from more support from government to support your aging work? Do you have an aging workforce? To what extent is workforce an issue, a challenge, an opportunity in this space?
I think opportunity. We have our workforce is highly specialised and actually is ageing, but we've had very long tenure. Actually, not just in the UK, but in our other two big manufacturing sites as well. But where we would like to do to invest more is, and with government support, is around apprenticeships, where you have the ability for those skills that have been long developed can be effectively passed down to younger people entering the workforce. And I think there's definitely an opportunity for stronger partnerships with universities as well. I think technology, through this pandemic, we're all using technology more than we ever have before. And I think that certainly, improved our skill sharing amongst our manufacturing sites as well, in a way that it hasn't done before, that just with pure travel is expensive, prohibits a lot of people traveling around to different sites. So I think there's a lot of opportunity there.
Great, thanks, Sharon. Amir, do you want to come in terms of the workforce angle from your point of view?
Yes, of course. Look, I think it's I think Mike said it's a massively untapped potential source of value creation for the country. There's huge amounts of capability that's available, and the business that we're in, I think that some of the ways in which we're thinking of deploying the system are around enabling older adults to start working again, start from home. I think the pandemic has really brought the usefulness and adoption of video conferencing into play. The pace of business has gone at light speed. It's unbelievable how fast things can now move, because people no longer have to get together physically. And if that's the case, well, let's bring in these people who have spent decades working in the economy, who've got so much experience, and mobilize them for an export market, right? I mean, this is exactly the kind of space that we can be in. We can really deliver different models, different services using this population and using the technologies that we're building here in the UK.
Thanks. No, that's really, really helpful. And John, before I come to our final round, Legal and General very kindly, I think 4 or 5 years ago, hosted with ILC the launch of the UK government's business champion on older workers, who at the time was Ros Altman, hosted by, and I think we had the Pensions Minister Steve Webb as well there. So clearly, Legal and General have an interest in older workers as a resource for yourself and in terms of this market as well, John.
Yes, that's right, David. We do, and a lot of it is about more flexibility, and I suspect we will see more flexibility as one of the sort of medium-term consequences of COVID. But the other point about workforce issues here, I think, is we need to think much more broadly as a society about how we facilitate the combination of elderly care and the workforce. I mean, I think you'll be very familiar, David, with the work that suggests there's 130 billion pounds worth of unpaid care work done in the UK, and obviously a lot of that hits very hard at women. And we need to find better ways to combine those two things in the voluntary side. So talking about returnships and about what leave arrangements are where elderly care is required and so on. It should be as important, really, as childcare. And then on the professional side of elderly care, we really do need to find ways to create a profession and a workforce that is properly regarded and given a career pattern to follow, possibly qualifications where that's appropriate, and to make that be capable of being taken really seriously as a professional occupation for people to have. So there's a lot to be done about workforce, and not just for our own employees.
Great, thanks, John. I'm going to ask all of our panelists now with their final comment, and Sophia, I might come to you last if that's okay with your sort of final sort of summing up or any other thoughts you've got based on the conversation. But I'll go in the same order we had people speaking initially. So start off with Mike. Any final comments or observations?
Keep up the good work that ILC does, particularly in the UK, but also through international benchmarking. What you do and your reports are a very good guide to help innovators and exporters do their job. Thank you.
Thank you very much, Mike. Do we pay you afterwards for the testimonial? No, thanks, John. Thanks, Mike. The next speaker we had was John, wasn't it? John, because I'm going to come to Sophia last. John, your final comments.
Yeah, sure. Am I unmuted, David? Can you hear me?
Fine. Yeah, I can hear you.
Aging is something to be celebrated. It's not a cost to society, but it's an opportunity. So we can use the accumulated wealth of an aging demographic to fund prosperity and opportunity for a younger demographic, would be my first thought. And my second one is to really give suitable emphasis to this idea of healthy life expectancy plus 5 years. It's so important. It's more important actually than absolute longevity. So we can have all the science in the world trying to enable Californian billionaires to live to 200, but that bears the same relationship as a Formula One car to your daily runabout. We need to make life better for the vast bulk of the aging population.
Great, thanks, John. Sharon.
David, I would just say a strong theme today has been the importance of preventative health. Obviously, I'm going to say that because I work for a vaccines company, but really important opportunity. UK has a leading program, and I think there's a lot more that can be done in the UK and around the world to help drive that longevity dividend.
Thank you. And Amir?
Just want to say, echo what was said earlier, really good job from ILC on getting information together for us. It's essential for the stage of our journey. We need as much insight and support to get our messages out there. So really appreciate this, and keep going the way you're going.
Thank you very much. And Chris, an opportunity for you to do another plug.
Well, again, thanks to ILC though for the research, because I think it shows the incredible opportunity there is economically for trade and investment in healthy aging as a whole. We're finding real interest in markets across the world, particularly in China, Southeast Asia, but also in the more developed markets. Actually, people who already developed a lot of ideas of their own are also looking for further new ideas. So Japan, Europe, US, we're quite surprised how much of they're interested in new ideas coming from us as well as investing in us. So there is a real potential in these markets, both developed and emerging. And I think the other thing to say is we talked about so many areas, but they're all really valuable things that we can offer to the world. We talked, for example, recently about workforce and the whole issue of training people who are quite informal carers or less experienced or less qualified carers, who often are much further away remotely from the services. And our digital remote systems are really important, not just in terms of accessing the person and the patient, but actually supporting the worker, the carer, to do their job. So I think we have real further opportunity there, as well as helping people develop service models, service systems. And of course, we've really rightly emphasized the whole digital technology side of things, but also medical technology that goes with the digital. And digital and medical technology now is becoming more and more overlapped. And of course, as we also heard, pharmaceuticals. So we are keen to support people in this endeavor to take our expertise abroad. We can really do good work in these countries. Of course, we're often looking for richer customers, if we're honest, but there's real opportunity to help expand health and care systems abroad. And we're doing that through the Better Health Programme, which is the Prosperity Fund funded programme from the UK government. And we are working on that jointly with the FCDO and others. So we're doing development work as well as commercial work. So we're very keen to identify people who want to come on this journey with us. It's not just about older people, it's about multi-generational living, and that's what I think we can really offer the world. Thank you.
Thanks, Chris. And we will provide some contact details or a way in which the link to the DIT relevant pages for those of you who are here and interested in that extra support. Sophia, any sort of final comments from you?
Yeah, sure. Thanks, David. I just really quickly wanted to tap into that point about older workers as an export market. I thought that's a really interesting point. And I do think something that's being talked about more recently is that, as we know that there's going to be huge technological change going forward, and one thing there might be a big strength in having emotional intelligence going forward. And we do know actually that on average, older adults tend to have accumulated over their working lives quite strong emotional intelligence. And that actually might be something to think about, that there is a comparative advantage there potentially in supporting, in having older workers in that kind of environment. So having workers of all ages, but really that could be particularly important going forward in that climate. And then and just overall kind of echoing everyone's points really, there are, in terms of, I think it's interesting that was raised, there is like a longevity dividend available from consumption, but actually also from the savings and investment potential. And so there's two areas there, and they're both really important. They both benefit GDP in different ways. And so if we get that right, that I think as mentioned, that would benefit people of all generations. So for instance, consumption can support the jobs of younger adults. And there's a lot of research saying that if older adults are in work and they're able to pursue, that supports people of all ages. And we do need to remember that in COVID, because I think the narrative has been sometimes not like pushing that view as much as it should be. But also investment, I think there's some really interesting points raised by John. There's a lot of potential there, and also for addressing climate change, there's a huge amount of savings and pension assets there. So there's also a lot of potential there. And then finally, I think, I haven't talked about this as much today, but in the report, really the crux of what we're, one of the key kind of points that we're mentioning is that investing in preventative health is really a way that it kind of underpins a longevity dividend, all the kind of productive activities that and a kind of flourishing life that we want older adults to be able to achieve, and preventive health can do that. Without that, there's many different things that might not be possible, so it kind of underpins that. There is a huge discrepancy in how much countries are investing in preventative health. There's a lot of inequalities in health, and without tackling that, it'd be very difficult, I think, to tackle to realise a longevity dividend going forward.
Thanks, Sophia. And another aspect, and John touched a bit on this, that will be in the final report that we're launching on the 12th of October, is around the, we've put some numbers on the economic value of care and indeed volunteering amongst amongst older people across the G20. So it's not just about work and spending money. You know, we need to make sure we are recognizing the other economic contributions that older people make. So thank you all for joining us. I think there's a very strong message around the relationship between, you know, John's health equals wealth, which we might steal as a title perhaps for something. Very grateful for Chris and Julie and the Department for International Trade for working with us on this and making this possible. We were hoping to do this in real life, but unfortunately not possible at the moment. In terms of things we've got coming up, and we've got a lot coming up that's really relevant to this agenda. On the 17th of September, next Thursday, we're doing an event on why is longevity important to business. So we've got 5 or 6 businesses really talking about why this issue matters to them. We're particularly keen, as I said, to emphasize the role of business in relation to the economic opportunities of aging. On the 29th of September, we are launching the second stage of our prevention program. We've got some really interesting speakers who we've never had at ILC events before, including the global health lead at Facebook, for example, World Economic Forum, World Federation of Public Health Associations. So we've got some really interesting speakers who I think will help kick off our stage 2 with a very strong sort of first session. And we'll be telling you about our plans for the next year in that. We're launching, as I said, our Global Longevity Dividend Report on the 12th of October. So please email in at the moment if you'd like to join that one. On the 24th of September, for those of you interested in the Asian market, we're doing a session on a couple of countries, couple of areas, Singapore and Hong Kong. So we're going to do a very specific session that talks about the work we've done with ILC Singapore on healthy aging in Singapore and a project we did last year on healthy aging in Hong Kong. So that's the 24th September. And then finally, our Future of Aging conference is due to take place in December, and we will send you some information about that. Please, thank you again for joining us. Please, to stay up to date with our news, join our website, join our mailing list via our website, and follow us on Facebook and Twitter. And we hope that you're able to join us at a future event. Thank you very much.